Welcome to the Clinical Education Initiative podcast, Conversations with CEI, where we feature conversations with clinical experts, their experience and insights on current health issues in the areas of HIV, primary care and prevention, sexual health, hepatitis C, and drug user health.
Hi, and welcome to Conversations with CEI. My name is Lauren Walker, and I'm the director of CEI's Hepatitis C and Drug User Health Center of Excellence. On today's episode, we'll hear about the current state of harm reduction, how it's implemented in clinical interactions with people who use drugs, and what the future may hold. It's my honor to introduce today's guest. Giorgio Handman is a social worker, an artist, and a lover of harm reduction. He graduated from the Silberman School of Social Work in 2012 and completed mindfulness facilitator training at the Engaged Mindfulness Institute thereafter. He has incorporated mindfulness into his social work practice and harm reduction work with young people experiencing homelessness, veterans, people living with HIV and AIDS, and individuals navigating substance use, and currently practices harm reduction at the REACH program at Mount Sinai. Giorgio is committed to working with community to promote wellness, joy, and harmony. Giorgio, it is a treat to have you here today. Thanks again for joining me. How is your day going?
It's going good. Yeah.
Great. Well, before we get started, or maybe just to kick things off, I think it'd be helpful for you to introduce yourself to our listeners. Would you mind telling us a little bit about yourself and your experience?
Yeah, my name is Giorgio Handman. I'm an artist and social worker, and I've been working in harm reduction for 15 plus years. And I started my first forays into harm reduction. We're hearing about harm reduction in the 90s, growing up with harm reduction messaging, really internalizing that. And then at some point being at a queer pride parade and seeing the Frosted Foundation for Research on Sexually Transmitted Diseases, or From Our Streets with Dignity, mobile van go by, and something about what I saw there attracted me. And I started to volunteer with Frosted and do outreach work with them a long time ago. And I loved it.
And how did that kind of evolve for you? So you started with this mobile unit. What happened next? Where did that life take you?
Yeah, I just really was doing that. I was doing outreach with sex workers in a mobile unit, and the folks at Frosted were just really amazing. It was primarily trans women and cis women who had lived experience doing sex work, and they were really welcoming and friendly and wonderful and amazing. And there was a doctor there. And I just loved the way everyone there was. It was a very loving, supportive environment. And also it had a nighttime energy of like going out into the night. And there was something exciting about it. And learned a lot there, and was probably just sort of in and out of being a volunteer there because I was pretty flaky then, kind of related to my own substance use journey, that I might not have been the greatest volunteer or intern, but I also learned a lot, and kind of was very interested in harm reduction ever since then.
I definitely don't want to put words into your mouth, but it sounds to me like the principles of harm reduction almost got you before you had the words to know that they were the principles. You were welcome into this community, and it's just I hear that a lot.
Yeah, it was very loving and welcoming. And also, for sure, I definitely tracked in my brain growing up in the 90s, it's different, safer sex messaging, and also different drug use messaging about how to use drugs, but not overdose and die, which was, I think, easier to do then in a way, than it is now. But yes, those things got deep. Yeah, I absorbed them because I was just, I absorbed them growing up. Well, it's been a real honor to work with people who use substances. And I do feel it's an honor every day. And substance use and using substances can emerge from curiosity, cultural reasons, also from a drive I think the Jungians talk about this towards transcendence, right? So it can be this special piece, this really special aspect of someone's life and experience, a drive towards something spiritual, something transcendent. Also, Ocean Vuong, a beautiful writer, talked about this, and I forgot how they said it, but they were talking about it's people who've really gone far in addiction who know what true generosity is. I'm paraphrasing them, but I find that to be really true. And also, it's people who've gone really far in addiction who know what kindness is. And that can be a real privilege to touch and to witness and to experience in relationship.
What's it like for you to work in the field with lived experience, and how does that impact your clinical approach?
Yeah, I mean, it's sort of funny because it's totally completely informs my life and my clinical approach. I think in a lot of ways because of all the access to resources that I have, that there's an experience that I don't share with many of the people that I work with. Even when I was experiencing addiction in like a very acute way, I had a lot of social capital. I had access to treatment. I had stable housing. I had supportive social networks. I had access to healthcare. So there's a lot of experiences that I don't share with many of the individuals I'm working with. So I'm just aware of that. And then, though, well, I wouldn't be doing this work if I didn't go through my own experiences with substance use because I went to social work school after I became much more stable and moved through my substance use issues into the place where I am now. And then it was like, well, what am I going to do? So now I work at a primary care program in a hospital that's a harm reduction program. And I think having experience using different drugs helps me be very casual and curious and about the whole conversation. I have a familiarity with substance use. That helps. And I think maybe that helps me be able to build genuine rapport with people that come into the clinic and across a lot of differences.
Listening to you, it just sounds so amazing that you are able to acknowledge your difference, but also relate. And I think for me, on a personal level, I would feel so much more comfortable disclosing to a clinician who is normalizing this behavior rather than questioning it, or maybe not even knowing what it is or having any idea of why someone would engage or want to engage in drug use. So just kind of changing that perspective a little bit, I think, has to probably have a very large impact for folks.
Yeah, well, definitely, because I'm working out of a hospital right now, like substance use is so stigmatized and people are scared to maybe talk about drug use candidly in a hospital-based setting. I mean, I don't necessarily know that I disclose everything from my history to providers that are my providers. And that's with a lot of years of distance. And so, yes, I definitely go there and model casual language about it, but that's also respectful and see what emerges and then, what would be helpful in the conversation.
I feel like we're already talking about this, but do you have any like examples or a person that you're thinking of in terms of applying these principles of harm reduction in practice around normalizing use and treating people as people, providing the dignity? Does anything come up for you?
The program I work at does a really wonderful job, and the providers are really attuned and have a lot of sense of different interventions and a lot of skills with motivational interviewing and just being personal and warm and caring and loving. And then in different settings, there are many medical providers and social workers and just people who aren't comfortable having candid conversations about substance use. There's this like war on drugs logic that, folks have sort of being accusatory or, stigmatizing this person's drug seeking or they're an addict or like a medical provider might be like, I'm not going to prescribe so and such medication. And I think it's by design, right? It was like the war on drugs, very racist policies, criminalizing substance use, having very harmful, all the harms, the racialized harms of the war on drugs from in so many different ways. And then that logic spreading through all sorts of different institutions, hospitals, and substance use treatment centers. And then a lot of that sort of abstinence-based mentality having a kind of like colorblind mentality to it too, that doesn't take into account the horrible harms that the war on drugs has had on communities of color. And so a lot of times people leave hospitals because they don't get adequately treated for pain, right? I think people leave the hospital sometimes and end up getting pushed out of care because there's been a underlying white supremacy around drug policy in this country from the beginning, and that gets expressed in laws. And then it also can get expressed in different behaviors, like being very goal oriented, there not being a lot of space for complexity or gray areas. It can be very dehumanizing and fast paced. And so countering that and really slowing down, and that idea of meeting each person where they're at and then allowing the conversation, the interaction to unfold in a very real and genuine way is a really important harm reduction principle.
And in particular, I guess I've been hearing a lot about harm reduction in the news lately, and particularly updated guidance on how federal monies can be used for substance use disorder treatment programs. So certain things that SAMHSA money used to be able to fund, like xylazine test strips, fentanyl test strips, are no longer eligible. So I'm curious if that letter has impacted the work you do, if you've heard anything about changes in harm reduction, or if that changes the work that you would like to do, if the people that you serve have heard anything about these changes or how they are impacting your life.
I think that's really, of course, it's really stupid to not fund fentanyl test strips, and they're helpful, and xylazine test strips as well. Many people are concerned and worried about the cuts to Medicaid and how that's going to negatively impact millions of people's health, and how it already has in different ways. I mean, there are ways that cuts to Medicaid transportation, I'll just name one. I'll just share a very sad case about one person who died, and they died directly because of these cuts. There was a person who was legally blind and went to a methadone clinic that he had good relationships with and rapport with for years. And then these Medicaid's cuts affected transportation. He was no longer allowed to go with Medicaid transportation to the clinic because it was in a different borough than where he lived. However, that did not take into account the fact that he knew how to enter that building, felt safe getting into that building, and had rapport with the providers there and had been going there for years. He never fully engaged with another clinic because he went to other OTPs, methadone clinics, and they were on more in his area that would be covered, but they were more crowded and just like not accessible to him as a legally blind person. And that person ended up dying, so the cuts have very severe effects, like every step of the way. So it's horrible.
Oh, wow. Giorgio, what a devastating and unnecessary loss. Thank you for sharing that person's story with us to, help put a human perspective on some of these policy changes. Despite the loss and the challenges, what brings you hope or excites you in the world of harm reduction?
I think, unfortunately, it's important to, hold an awareness of all the negative things that are happening now and the challenges to so many communities and to harm reduction that we're currently facing. And to hold those and to advocate and to navigate these situations while also still connecting in small, meaningful, different ways with individuals while doing this work, that can feel really wonderful and connected. And to share those moments with each other is really important. Moments of connection, moments of joy. So I think it's a both and situation, and continuing to organize and advocate at the same time. I'm excited by Vocal New York all the time. I'm excited by, the work we do at Reach. I'm excited by, the way the folks at Vocal do community organizing. I'm very excited by that and then lucky to have been able to sort of like witness that and see how that's done in such a great way. Yeah, I'm excited by, you know, these moments where, well, it's like a tricky thing with harm reduction too, because I am human and I do like it when people are smiling and doing well and like giving hugs and being like, I'm feeling well. And also, we're just talking about this with colleagues. Like, we don't want to uplift that to the point where then individuals feel bad when they're using and struggling and going through something. Yes, it can be fun to have some harm reduction interactions. Yeah, joy and creativity and playfulness can be part of it. Not always, right? Because if there's like a crisis going on, there can be a lot of seriousness to it. But it is true trying to figure out how to build rapport and develop a genuine relationship that is felt as loving or caring or connected is really important. And of course, that's going to look and feel different with every duo of people. So everyone does that in their own way, but that feels like this special magical sauce in a way of connecting, being open and playful.
Amazing. I love that. Thank you, Giorgio. As we kind of come to a close here, I'm wondering what you wish everyone knew about harm reduction.
I wish everyone knew how harm reduction can be supportive and helping people be more friendly with themselves. Harm reduction really allows for moments of genuine connection. It allows for love to flow and to emerge. It encourages people to stay in relationship and stay connected. And so much of addiction can be about disconnection and isolation. So it really supports community. It allows and makes space for people to be more friendly and gentle with themselves, which is wonderful. It creates spaces for self acceptance wherever someone's at in their journey is. Like Carl Rogers says, when you accept yourself just as you are, that's when you can really change. It also creates more access to care because it's all about staying engaged with care. It's all about staying in relationship and staying authentic. So in that way, it also, harm reduction allows for many different possibilities that can be life-saving, especially around drug use, around safer using practices, around if any kind of treatment is called for that to be accessible. So it just keeps folks connected. And I think, it's really helpful in that way and really amazing in that way. And it helps me be more friendly with myself. Yeah.
Giorgio, it has been a pleasure talking with you. Thank you again for joining Conversations with CEI and sharing your expertise and your life experience with us.
Thank you. Thank you so much.
Thank you for tuning in. Join us next time for a new episode of Conversations with CEI. Visit us at ceitraining.org and follow us on CEI social media platforms.